I am Dr Puttaraju K. I am a physician and diabetologist. I am practicing at Spandana Healthcare Center, 3rd Main, Ashok Nagara, Tumkur, Karnataka. What is diabetes? Glucose is the main source of energy for the body's cells. The blood glucose levels are controlled by a hormone called insulin. Insulin helps glucose enter the body's cells, which is used as energy. Diabetes is a condition that occurs when the body cannot use glucose normally. In diabetes, the body is not making enough insulin or it cannot respond normally to insulin. This causes rise in blood sugar levels leading to diabetes. How do I know if I have diabetes? What are the common symptoms and signs of diabetes? One of the most important things to remember is that diabetes does not always produce symptoms or signs until it is very advanced. It is a silent disease. One may suspect diabetes if one person has few of the following symptoms, that is unexplained tiredness, frequent urination, excessive thirst, and the person tend to drink excessive amounts of water, increased hunger, and the person may eat more than usual. There may be weight loss despite good appetite. A high blood sugar level makes it hard for the body to fight against infections. So a person affected with diabetes is more prone to develop infections of the skin, urinary tract, or gums. Itching of the genital area is common and wounds do not heal easily. Diabetes can affect the eyes also. High blood sugar levels can cause the lens to swell so that the vision may become blurred or foggy. So it is important to get your blood sugar levels checked often if you feel any of the above symptoms. What are the types of diabetes? There are majorly 3 types of diabetes: type 1 diabetes, type 2 diabetes, gestational diabetes. Type 1 diabetes is also known as juvenile diabetes because it is commonly seen in children and adolescents. In type 1 diabetes, virtually all of the insulin producing cells of the body are destroyed. Everyone diagnosed with type 1 diabetes must take insulin injections throughout their life to manage their blood glucose. Type 2 diabetes is more common form of diabetes, accounting for about 90% of all cases of diabetes. Here, insulin is produced by the body, but it may not be sufficient for the body or body may not be able to use it normally. This often happens if you are overweight or obese. Thus, glucose builds up in the bloodstream and leads to type 2 diabetes. The third type of diabetes is called gestational diabetes. It is a condition that develops in some females during pregnancy. Blood glucose levels rise only during pregnancy and they are normal before and after pregnancy. However, the condition makes the mother and the child at risk for development of diabetes in future. Who is at risk of developing type 2 diabetes? We do not know why some people develop type 2 diabetes and others do not. However, there are certain factors that increase the risk of developing type 2 diabetes. That is age. Advancing age increases the risk of type 2 diabetes, especially after 40 years. However, in recent years, the incidence of type 2 diabetes has been increasing dramatically among children, adolescents, and young adults, probably due to increase in the prevalence of childhood obesity. The second risk factor is family history. If one has a parent or sibling affected with type 2 diabetes, the risk of getting diabetes increases. Overweight or obesity. Being overweight is a primary risk factor for type 2 diabetes. The more fatty tissue one has, the more resistant the cells become to insulin. However, one does not necessarily have to be overweight or obese to develop type 2 diabetes. Even lean individuals can develop type 2 diabetes. Inadequate physical activity. The less active one is, the more likely to develop type 2 diabetes. Physical activity helps control weight, use glucose as energy, and increase the sensitivity of the cells to insulin. Unhealthy diet. A diet rich in calories, saturated sugars, and fats, low in fiber, can lead to an increase in body weight and thus increases the risk of developing type 2 diabetes. Having high blood pressure and high lipids or fat levels also puts a person at risk of developing type 2 diabetes. Gestational diabetes. Women who develop diabetes during pregnancy have a higher risk of developing type 2 diabetes. If the baby born to such a woman weighed more than 4 kgs is also at risk of developing type 2 diabetes in future. What tests can be done to check for diabetes? Diabetes can be detected based on blood sugar level. Fasting plasma glucose is commonly used test. It detects the amount of sugar in the blood after one has not eaten for 8 to 10 hours, that is after overnight fasting. A fasting plasma glucose value of equal to or more than 126 milligram per deciliter suggests that the person has diabetes. The other test is oral glucose tolerance test, OGTT, is another type of test for detecting diabetes. The blood sugar level is checked in the fasting state and then 2 hours after drinking a certain amount of glucose solution. It shows how the body processes glucose. If the 2-hour value is more than 200 milligram per deciliter, it indicates the presence of diabetes. Another test called HbA1c or glycosylated hemoglobin. It measures how well the blood sugar has been controlled over the past 3 months. If the HbA1c value is equal to or more than 6.5%, also indicates the presence of diabetes. What are the complications and consequences of diabetes? The complications of diabetes develop gradually. When too much sugar stays in the bloodstream for a long time, it can affect blood vessels, nerves, eyes, kidneys, and cardiovascular system. Complications include heart attack and stroke, severe foot infections, often leading to gangrene, which may result in amputation of the foot or leg, kidney failure, and sexual dysfunction. After 10 to 15 years of onset, the prevalence of all diabetes related complications increase markedly. Can diabetes complications be prevented? The good news is that all complications of diabetes can be prevented by doing the following important things. Eat healthy. Eat more vegetables and fruits, less fatty, sugary and salty food. Stay physically active. Take medicines regularly as prescribed by your physician or doctor. Keep a track of blood sugar levels by frequent monitoring and go for regular checkups. Go for regular eye checkups, heart and kidney checkups as per the advice of your doctor. Watch for any tingling or numbness, burning, loss of sensation and wounds on the bottom of the feet by yourself. Can diabetes lead to serious emergencies? Yes, it can lead to serious and life-threatening medical emergencies. These can occur if the blood sugar level is too high or too low. Low blood sugar level, often called hypoglycemia, is the most common complication seen in individuals with diabetes. The blood sugar level may suddenly become too low for various reasons, including vigorous physical activity, taking wrong dose of insulin or anti-diabetic medication, or not eating enough or eating too late. It is usually mild and can be treated quickly by eating or drinking something with a high sugar content. The symptoms of low blood sugar levels are non-specific. The patient may feel tired, experience giddiness, sweating, palpitations, and hunger. In severe cases, low sugar can cause loss of consciousness and the patients have to be treated with intravenous glucose immediately. Very high blood sugars can occur if one skips medications or during infections and stressful situations. Diabetic emergencies are best treated in a hospital setting as quickly as possible. Is it possible to prevent diabetes even if my risk is high? The cause of type 1 diabetes is not known and it cannot be prevented with the current state of knowledge. The onset of type 2 diabetes can be prevented or delayed with simple lifestyle changes. Achieve and maintain a healthy body weight. Go for a brisk walk for at least 30 minutes every day. Instead of walking, you could opt for dancing, gardening, or be actively involved in games and sports. Try to avoid sitting for a longer duration. After sitting for 20 to 30 minutes, move around or at least stand up. Try and make healthy food choices. Focus on your portion size. A simple yet effective way to do this is to choose a small plate for your meals. Eat fiber-rich fruits and vegetables every day. Prefer having a piece of fruit over a cup of fruit juice. Choose whole grain foods such as whole wheat and brown rice. Avoid tobacco and harmful use of alcohol.